Surgical skills. The editorial this month on WorldOrtho is an audio presentation via YouTube. I hope you enjoy it, and I hope this new format will keep you engaged with our work. Recently, in an Australia New Zealand Journal of Surgery, they talked about heuristics, H-E-U-R-I-S-T-I-C-S, basically a word derived from the Greek meaning process of discovery, and it's usually applied to surgical skills. So now we have our journal starting to look at surgical skills, how surgeons use their hand to treat and fix patients, and I applaud them for this. It's about time we started to do it. I know the AOA have been running labs showing people how to use their devices. There are cadaver labs and surgical labs, but there's actually no science based around it, or no body of writing based around it. It's about time we did this. Do you know that pilots train pilots now in their flight training centres? Well, we should have surgical training centres with simulators to train surgeons. We've left too much surgical training in the hands of VMOs and part-time people who've got very little interest in academic matters. Surgical training should go back and be placed into universities, and we should have an academic approach to it. Now, I started thinking about, well, what is surgery about? What are we trying to achieve with surgery, and how do we do it? So let's think about this. What is surgery for? Well, it's funny that you can do surgery for a long time and never actually sit down or discuss it with a colleague what you're actually trying to achieve. Well, first thing is you're trying to fix or repair the body when it's broken. It's obvious in orthopedics, a broken bone, fix it. In other areas of surgery, stop bleeding, often after an injury or fall, inside a damaged head, chest or abdomen. Next big area is unblocking blocked tubes, arteries, coronary artery surgery, peripheral vascular surgery, the urethra, prostate surgery, the intestine obstruction from strictures or tumour. Third thing, well, adhesions or tumour. Third thing is removing tumour or cancers, breast cancer, bowel cancer, lung, skin cancers. Next thing, we try to reconstruct if possible, or replace with implants. The body's pretty much like a car. When it breaks down, fix it up. Don't tinker around with it. And often you either replace parts to get it going quickly. So these replaced parts can be either man-made or from another person, transplant. See, breast reconstruction, rebuild it. Worn out joints, put in an implant, something synthetic, hip replacement, knee replacement, or from another person, heart or kidney transplant, for a few examples. And the last thing is the cosmetic surgeons, well, they're seeking to enhance the body. So when you think about it, surgery is all about restoring, sometimes bettering, the normal anatomy. It's as simple as that. Now, how do we go about doing this? First of all, realize and remember, surgery is the work of our hands. Our instruments are an extension of our hands. And we need to keep developing instruments and refining them. I was very disappointed to hear a colleague tell me that he found in Egypt, on some of the tombs there from the ancients, drawings and descriptions of surgical instruments. They look pretty much like the instruments we use today, so they don't seem to have changed much. We need to catch up. So, how do we do it? Here are the principles of surgery. We go from the skin deep to the area that we're working or need to work on to fix up the problem. Point 2. We try to disturb as little as possible the normal anatomy, e.g. keep our incisions small, keep the dissection minimal, use icing or medication and minimize the inflammatory response to surgical trauma. Next thing, get the patient back to their normal life as quickly as possible. And lastly, what we leave in the body, our implants, should be as close as possible in anatomy to what was there before. Sometimes they do vary, but as close as possible in principle. I would like to think that MIS, or minimal incision surgery, seems to be an approach to achieve this. So I hope you've enjoyed this. Basic principle, what it is we're trying to achieve in surgery, and how we go about doing it, using our hands as a surgeon. And I would applaud the journal and other colleagues developing a body of science around how we actually operate, rather than leaving an arbitrary manner to be learnt on the job. We need to establish in university settings, academic centres of learning, the principles of how we do this and start researching it seriously. Perhaps have a flight simulator, a surgical simulator. Thank you for your interest.